Greetings friends, I'm Dr. Davidson. Welcome to Dr. Davidson Integrative Medicine. In my last video, we compared conventional medicine, which focuses primarily on managing symptoms, to functional or integrative medicine, which strives to discover and address the underlying factors at the root of the health problem, ultimately the problem that's causing the symptoms in the first place. And I gave the example of how I was able to help a patient with heartburn by addressing the underlying factors responsible for the heartburn, ultimately resolving the condition. Today, I'm going to talk to you about the power of using plants as medicine, and I will later give examples of how patients with certain chronic conditions such as high blood pressure, high cholesterol, heart disease, and even conditions like arthritis can benefit from using plants as medicine. To give you an example of just what I mean, let's take a look at some classes of commonly prescribed medications, such as medication used to treat high blood pressure, high cholesterol, and blood thinning meds. If people knew that the actual chance of benefiting from these medications is less than 5% over 5 years, according to a clinical study by Truby and colleagues, most would choose not to take them. Be advised, however, if you're already taking these medications, don't discontinue them without first consulting a qualified healthcare professional. Now, if we compare these medications to a simple dietary intervention, a dietary change, changing from the standard American diet to a whole food plant-based diet, a diet composed of vegetables, fruits, nuts, seeds, legumes, whole grains, and excluding animal products. The power of this diet, the benefit derived from this change, is 20 times greater than any of these medications. According to Dr. Esselstyn and colleagues in their study, over 99% of the patients that managed to stick with this whole food plant-based diet at high risk avoided major cardiac events, including death from a heart attack or stroke. Now that's powerful medicine. Beyond this, there are some plant medicines that are so powerful, have such profound health-promoting effects, that they can be used alone to prevent and even support patients with some serious chronic conditions such as arthritis, be it either rheumatoid or osteoarthritis. Now, to demonstrate this, let's compare a common yellow spice called turmeric to a class of medications called non-steroidal anti-inflammatory drugs, or NSAIDs for short. Some common brand names in this category include Advil, Motrin, Aleve. You've seen the TV commercials, advertisements telling you that they're gentle and safe. In reality, these drugs are anything but that. Indeed, the side effects of NSAIDs include ulcers, kidney damage, gastrointestinal bleeding, heart attacks, strokes, just to name a few. In fact, adverse drug reactions or side effects from medications are the fourth leading cause of death in the US, ahead of pulmonary disease, diabetes, pneumonia, even accidents and automobile deaths. If we compare that to the side effects of turmeric, which are more along the lines of some perspiration from an overly spicy meal, there is simply no contest. You see my point. Now, both the drugs NSAIDs and the plant turmeric can be used for their anti-inflammatory properties in conditions like arthritis. However, NSAIDs only treat the symptoms of the disease, all the while driving the disease harder in the long run. They make it worse. On the other hand, turmeric actually addresses the underlying pathophysiological factors driving the disease. Turmeric downregulates inflammation. It prevents complications with a host of favorable health-promoting effects, ranging from anti-cancer properties to improved tissue repair and regeneration to improving the body's intrinsic detoxification abilities. So is there any question as to which of these should be considered the first-line therapy and which should be the last resort? Let us not be so narrow-minded in our thinking that we overlook the possibility that nature may have already provided us with the perfect medicinal tools, such that our best scientists can only dream of synthesizing themselves in a laboratory. Unfortunately, despite successful, historic, and continued use for hundreds of years in medical systems around the world, these sophisticated health-promoting technologies that plants offer us, often at so little cost, are ignored or forgotten in the US conventional medical system. And last resort treatment seems to become the only choice for the patient. As a specialist in using plants as medicine to address underlying factors responsible for your health problem, I will not allow this last resort treatment to become your only choice. Contact me at Dr. Davidson Integrative Medicine to request your free introductory integrative healthcare consultation and regain control of your health.